Doctor, thank you for your time today. The other day, I had a carotid artery ultrasound as part of my health checkup, but to be honest, I don't really know what this test is for.
I appreciate your visit today. A carotid artery ultrasound is a test that uses ultrasound waves to examine the carotid arteries on both sides of your neck. It helps check for arterial hardening, atherosclerosis, and blood flow conditions.
I see. So it's a test to examine the blood vessels in the neck. But why was this test included in my health checkup?
In many health checkups, a carotid artery ultrasound is done as part of cardiovascular risk assessment. It's especially useful for early detection of atherosclerosis and for evaluating stroke risk.
That makes sense. But I also heard that this test can detect thyroid abnormalities. Is that true?
Yes, that's correct. A carotid ultrasound doesn't just show the carotid arteries, it also captures surrounding tissues, including the thyroid gland. So if there's a thyroid nodule or tumor, it might be accidentally discovered during the test.
Doctor, you mentioned that thyroid abnormalities can sometimes be found during a carotid artery ultrasound. How common is that?
Around 6 to 10% of people who undergo a carotid ultrasound have some kind of thyroid nodule or tumor detected.
That's a pretty high percentage. I wasn't expecting that.
This is largely due to advancements in ultrasound imaging technology. In the past, small abnormalities were difficult to detect, but modern ultrasound machines can now pick up even the tiniest changes.
So thanks to technological advancements, early detection is now possible. But if something is found, what should I do next?
That's a very understandable concern. However, the majority of thyroid nodules are benign, non-cancerous. In fact, only 2.6 to 8.3% of detected nodules turn out to be malignant, thyroid cancer.
That's a bit of a relief. But how do you determine whether a nodule is benign or malignant?
First, we examine the size, shape, and internal structure of the nodule using ultrasound imaging. This helps us assess whether it appears benign or potentially malignant. If necessary, we may perform a fine needle aspiration biopsy, where we collect cells from the nodule to analyze them at a microscopic level.
I see. So you conduct detailed tests to make a clear diagnosis.
Exactly. Thanks to improvements in ultrasound technology, we can now detect nodules as small as 5 millimeters.
That's amazing. It's incredible that such tiny abnormalities can now be found.
Yes, and because of this, early detection rates have significantly improved.
It's reassuring to know that these things can be found early, but if something is detected, what are the next steps?
If a thyroid nodule is found, the first step is to consult a specialist. This is essential to accurately determine whether it's benign or malignant and to decide on the appropriate course of action.
So I would need to see a specialist. But if the nodule is benign, what happens then?
In most cases, benign thyroid nodules don't require any immediate treatment and are simply monitored over time. However, if the nodule grows significantly or causes pressure symptoms, then surgical removal might be considered.
And if it's malignant?
If the nodule is cancerous, the primary treatment is usually surgery. However, in some cases, surgery may not be the only option. For example, if there's a risk of recurrence or distant metastasis, additional treatments like radioactive iodine therapy might be recommended.
I see. It's reassuring to know there are clear treatment options available.
Absolutely. The carotid artery ultrasound is not just a test for atherosclerosis, it also helps detect thyroid abnormalities early, making it a valuable screening tool. Regular checkups and early detection are key to maintaining good health.
I understand. I'll make sure to get tested regularly. Thank you for explaining everything so clearly.
You're very welcome. If you ever have any concerns, please don't hesitate to ask me anytime. Regular checkups and early detection are crucial for maintaining good health. To everyone watching, I strongly encourage you to get regular health checkups and be proactive about early detection and prevention. Taking charge of your health now can make a big difference in the future.
Doctor, thank you so much for today. I've learned a lot.
It was my pleasure. I'm really glad I could help. If you're interested in more health-related information, be sure to check out our other videos. We'll continue to provide helpful content to support your health. Thanks for watching, and I'll see you in the next video.